making sure your back is flat and straight and the motion's coming from your pelvis.
Best exercises for osteoarthritis of hip and knees. Exercise may be the last thing on your mind if you have osteoarthritis or OA in your hips or knees. It might be difficult to exercise when you have symptoms such as joint pain and stiffness. Moving, on the other hand, is critical for hip and knee OA. It compresses and releases your joints, allowing blood, nutrients, and oxygen to flow into the cartilage. Eric Robertson, DPT, a physical therapist and associate professor of clinical physical therapy at the University of Southern California, says this can help extend the function and lifetime of your joints. Physical activity can also improve your mood. According to Leigh F. Callahan, PhD, Associate Director of the University of North Carolina, Thurston Arthritis Research Center. Along with improving your general health, exercise can help your OA symptoms, including pain, stiffness, tiredness, and even melancholy. According to one study, persons with knee OA who exercise on a regular basis saw a 12% reduction in pain compared to those who did not. Are you ready to put your sneakers on? There is no one-size-fits-all workout. However, some exercises are beneficial for OA in the hips and knees. Experts recommend combining the three workouts below. But before you begin any new physical activity, make sure to consult with your doctor. We're going to find out in today's video where we discuss best exercises for osteoarthritis of hip and knees. But before we go on with our video, don't forget to like and subscribe to our channel for new and spicy video. Now let's get going.
And the reason for that is that this joint has some of the highest stress on it of any joint in the body.
What is osteoarthritis? The most prevalent kind of arthritis, osteoarthritis, affects millions of individuals throughout the world. When the protective cartilage that cushions the end of the bones breaks away over time, it causes this condition. Although osteoarthritis may affect any joint, it is most often seen in the hands, knees, hips, and spine. Although the damage to the joints cannot be undone, the symptoms of osteoarthritis may typically be controlled. Staying active, eating a nutritious diet, and receiving some treatments may help delay disease development and improve pain in joint function. Causes of osteoarthritis. Osteoarthritis develops when the cartilage that cushions the ends of your bones in your joints deteriorates over time. Cartilage is a tough, sleek tissue that allows for virtually frictionless joint movement. If the cartilage is totally worn down, bone will rub against bone. Osteoarthritis is sometimes referred to as a wear and tear condition. However, osteoarthritis affects the entire joint, not only the cartilage. It causes bone alterations and the connective tissues that keep the joint together and connect muscle to bone to deteriorate. Inflammation of the joint lining is also a side effect.
Just push out. You don't want to feel pain, but you want to feel a little bit of tension. You want to feel those muscles activating.
Aerobic exercise. This is the type that strengthens your heart and improves the function of your lungs. Callahan adds, it also burns calories, which can help you shed or maintain a healthy weight. This is critical since excess pounds put more strain on your hip and knee joints. Start with low-impact exercises if you're new to fitness. They are easy on your joint. The following are some good choices for hip and knee OA. Walking, swimming, biking, elliptical training, cross-country skiing. Don't try to accomplish too much at once to relieve discomfort and reduce the risk of damage. Start with 10 minutes, advises Arena Garg, MD, a rheumatology fellow at Louisiana University Health Sciences Center for Excellence in Arthritis and Rheumatology. Every few days, add 15 to 10 minutes to that time. Working up to 30 minutes of aerobic activity 5 days a week is your objective. Strengthening exercise. Your joints are supported and protected by strong muscles. According to William Oswald, DPT, a physical therapist and clinical teacher of rehabilitation medicine at NYU Langone Health. Strengthening the lower body relieves some of the pressure on the hip and knee joints. This may help to alleviate some of the discomfort while also preventing further harm. It can also make everyday chores simpler, such as ascending the stairs, he adds. You may learn the finest leg strengthening exercises for your joints from a physical therapist. A flexible resistance band or small weights can be used. Yoga, Tai Chi, according to Callahan, can help you gain strength and enhance your balance. Look for lessons designed specifically for arthritis sufferers. However, you are not required to enroll in a class or visit the gym. You may also use your own body weight as a resistance. These exercises are designed to strengthen the muscles that support your hip and knee joints.
As you feel more confident, you can reduce contact and support from the wall or table.
Sit to stand. Take a seat in a chair, slowly rise and return to a sitting position without using your hands. Maintain a wide stance with your feet shoulder width apart and your knees over your toes. If you want assistance, utilize the armrests to lower yourself. Rep for another 30 seconds. Mini squats against the wall. Stand your back with a wall and head against it. Your feet should be shoulder width apart. Squat down until your knees are bent at a 30-degree angle. Return to a standing position by pressing up again. Rep 10 times more. Balance on one leg. Place one hand on a counter or table for support as you stand next to it for up to 10 seconds. Lift one leg and balance on the other. As you gain strength, you may be able to utilize only one finger or perhaps let go of your support entirely. Repeat on the other side. Range of motion exercise. To relieve stiffness in your hip and knees, try these exercises. They can assist you in increasing your flexibility and mobility. To begin, perform the hip and knee exercises listed below a few times each week. Eventually, you should be able to do this on a daily basis. For knee flexion when sitting. Sit on the chair's edge. Check that the chair is sturdy and won't fall over. Raise one leg and grab the shin with your hands. Pull your shin toward your thigh gently. Hold for 1 to 2 seconds before lowering to the ground. Change sides. Rep 10 times more. Knee extension when sitting. Take a seat in a chair. Extend one leg as far as possible or until it is parallel to the floor. Hold for 1 to 2 seconds before lowering to the ground. Change sides. Rep 10 times more. For hip, stretching the hip flexors while standing. Keep forward 1 foot until your feet are hip distance apart. Keep your upper body straight while bending your rear leg slightly and gently bending your front knee. Make sure your front knee doesn't reach past your toes. Hold the position for 5 to 20 seconds. Rep 10 times more. For support, you may need to grab a wall or the back of a chair. Knee to sternum. Lie on your back on the floor, knees bent and feet flat on the ground, or straighten your legs in front of you. Make a fist with one of your knees. Pull your knee in close to your chest. Hold the position for 1 to 5 seconds. Switch to the opposite side after 3 repetitions. What exercises should you avoid if you have osteoarthritis in your hips and knees? Experts used to advise individuals with hip and knee OA to avoid high-impact movements like jogging and leaping. The aim was that they would overload the joint and cause injury. For those with mild to severe OA, however, the opposite may be true. The impact might trigger cartilage repair cells, adds Oswald. However, this does not imply that you can immediately get on a treadmill. If you're just getting started, you'll want to focus on increasing your strength and flexibility first. This may help you to avoid being hurt. Then gradually incorporate high-impact exercises, Robertson advises. For example, start with 5-minute jogging. Do you have a severe case of OA? It's likely that you'll need to avoid high-impact activity entirely. The following workouts should be done with caution. See your doctor to see whether you are able to undertake them. Running, especially on uneven ground, requires a lot of energy. Tennis, basketball, and other sports that need fast direction changes. Step aerobics and other jumping-based routines. These activities that we did today are appropriate for persons who have osteoarthritis. However, the most important takeaway lesson from today is to keep your body moving. Hope you like this video. See you guys in the next video. Don't forget to like, share and subscribe to our channel. Take care, stay safe.